let's walk through kind of like the holy grail of surgery, which in my mind is considered a Whipple. So what is a Whipple procedure? Well, a Whipple is a pancreaticoduodenectomy. And this is going to bring up an important topic that all surgical resections are based upon blood supply. So that's something that you really need to understand. So let's break this down very simply. So you're taking out the duodenum and the head of the pancreas, which the duodenum is very intimately attached to. And the reason you have to resect both these critical structures is because of the blood supply. So from up top, you have the gastroduodenal artery, which gives off a superior pancreaticoduodenal artery, which then gives off an anterior and a posterior branch. So it's hugging the head of the pancreas like this. That's coming from the celiac trunk. And then inferiorly, you have the inferior pancreaticoduodenal coming from the SMA with also an anterior and a posterior branch. So they're both hugging the head of the pancreas and giving blood supply to the duo. And that is why all of those structures have to come out. So if you just resect the head of the pancreas, you're then left with either part of the body and the tail. So then you have the pancreatic duct. So now we need to talk about the different anastomoses that have to happen during a Whipple procedure. So one, you have your PJ, your pancreaticojejunostomy. So you're taking the pancreatic duct and you're attaching it to the jejunum. Then, because we took out the duodenum, you're now left with stomach and jejunum. So then you also have to do a GJ anastomosis, a gastrojejunostomy. And then lastly, you're taking out the gallbladder and the common bile duct. So you're left with the common hepatic duct, and that we would say is called the HJ, the hepaticojejunostomy. So in my mind, this is like the holy grail of surgery. And in surgery, we call the head of the pancreas the surgical soul because it's just such a complex area anatomically. So anybody give me some tips and tricks and other information that you guys appreciate about the coveted Whipple procedure.